Hello, good evening. Dr. Trudy Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our YouTube Open Clinic. This evening, we're going to look at asthma and women's health, fertility, and pregnancy. So please, once you join, introduce yourself. Let's know who you are. And I'm going to start the clinic any moment from now. So just give me 1 minute. Let me situate myself so we can get started. So we're going to talk about asthma. Okay. And you're going to learn what asthma is all about, especially as it relates to women. For some reasons, women have more severe attack compared to men. This is because women have shorter lungs. And there are some other unique characteristics that might make a woman to be more prone to having asthma attack. So please quickly join the clinic. I'm going to take time and make things a little bit better. Then afterwards, you can ask your questions. We actually have a lot of things to talk about, so I'm actually going to start. When I'm done, you can ask your questions and you can glean a couple of things. Now, it's important to understand that when you develop this condition, it's chronic. So it means it's a condition you will manage throughout your life. So if you're currently asthmatic, the best way to go about your asthma condition is to know what you need to do so you can prevent the triggers that will lead to asthma attack. Now, what's asthma to start with? So it's a chronic lung disease. So chronicity means something that has been around for a long time. The opposite of chronic condition is acute condition. So acute condition means something that can easily develop immediately. But when you have a chronic condition, it's a condition that has developed then over time. Matter of fact, in medical field, we use 6 months to separate acute from chronic conditions. So asthma is a chronic lung disease. So it's actually in the lungs and it affects the bronchial tubes. So you see, we have two lungs. So consider your lung like the tree. Then you have branches. So you have the left and the right lung. Now, how do the lungs function? When you breathe through your nostrils or through your mouth, so those are the two areas you can actually let air in, right? When you breathe, the air will go through the bronchial trees, the bronchial tubes. This is how you get things going. So when you're breathing, the bronchial tubes will accept the air, filter and do all those stuff before it gets to the lungs. So this is the mechanism. When you are breathing, you are taking in oxygen and you are removing carbon dioxide. These are the two gases you actually contend with. When you take in the oxygen will travel through your bloodstream to get distributed to all parts of the body. Without oxygen, you cannot function. The reason why I'm talking to you guys today is because I'm breathing in oxygen. Oxygen is going to all the cells in my body, and I'm doing better. Now, when you have asthma, the lungs and the bronchial trees will be inflamed. So inflammation means they will likely swell and they will become sensitive, oversensitive. So when your bronchial trees and your lung environment swells, you are not gonna breathe well. When you are not breathing well, you are not getting enough oxygen. When you are not getting enough oxygen, your body is being deprived of the primary role. Remember, the only thing that will keep you alive is oxygen. The moment you lack oxygen, it's either will give you oxygen or something terrible will happen. So when people with asthma breathe in, based on triggers, so I want you to pay attention to the word triggers. So triggers are those stuff that when you get exposed to, they will trigger your asthma. Smoke, anything in the air, cold, mold, chemicals, perfume, some pets, some paint, anything around can be your asthma trigger. So your duty is to know what your own unique asthma trigger is all about. Now, when this happens, it limits the inflow of oxygen into your body and you begin to have difficulties breathing. Now, each person might have different triggers for asthma. So what might trigger someone's asthma might not trigger your own. So frying or cooking in the kitchen or dust can trigger someone else's asthma. Then the other person might be cold. It might be outside. It can even be perfume. So if you're living with people that have asthma, or if you have asthma by yourself, you really need to take time to study what triggers your own. And unfortunately, it can change. So this season, you might be triggering from dust, then suddenly it will flip. But you need to study yourself properly. Now, there are presentations. You have to be very conversant in asthma. I'm going to mention them. These are the classical way that people that have asthma will present when they are having an attack. You will start wheezing. When you are wheezing, you remember how your kettle is boiling, right? When your kettle is boiling, it's kind of whistling, right? So when you are conscious of that noise you make, like you're trying to grab the air that will keep you alive, that particular process, that particular phenomenon is called wheezing. Is classical for all people that will have asthma. Now you begin to gasp for breath, breathlessness. You feel like you're drowning. You feel like you can't really catch the air. That's also a presentation of asthma. Then you begin to feel tightness in your chest. And when all these things are happening, what's going to happen? You're going to trigger your cough reflex. Anytime you're coughing, it means there is something in your body trying to stop you from living. So you're coughing to push it out. So most people that have asthma and asthma attack will wheeze, classical, have shortness of breath, breathlessness, tightness, then cough. Now, for some reason, when you have asthma, especially women, when you get to age 15, we noticed that it begins to be more common in girls and women compared to men and boys for some reasons. Now, women with asthma will also present differently during different phases in their cycle. There are some women, their asthma will be highly exacerbated when they are bleeding, when they are ovulating, when they are stressing. You begin to notice a flare-up of your asthma. If you pay attention to your body, you will notice this. Now, when you are also pregnant or you're intending to be pregnant, it's important you know the basic things you can do to prevent and stop the attacks, because the problem is the attack. Remember, you have this thing for life, okay? It's chronic. It's there. You're going to manage it for life. So your duty is to make sure you prevent the attack. So there are some people who will give some preventive drugs to avoid the attack. So take your medications, make sure it's properly controlled before you begin to think of having a baby. Now, how does asthma attack women? For some reason, from the studies we've noticed, asthma attack women differently. So women tend to experience more severe symptoms compared to men. Now, why is this so? Because women have smaller lungs compared to men. When they have these smaller lungs, it makes them to be more sensitive to the triggers. So men can handle a couple of things before they eventually break down. So we notice that women go to the hospital for asthma treatment more often, and they look for quick relief and rescue medications more than men. So asthma attacks women more than men in severity. So we need to know this. So I've already mentioned the symptoms, right? The classical symptoms: wheezing, coughing, shortness of breath or breathlessness, chest tightness. Now, you may notice you might have only one or two of these symptoms. So some people will not have everything. You might have wheezing, you might have coughing, you might have shortness of breath. Now, it's important you take notice and pay attention to your own pattern. You may also not even have any symptoms, but you have asthma. Some people can have juvenile onset asthma, or some people can have seasonal asthma. So you need to know what's unique in your own situation. Now, some people can also have exercise-induced asthma. So anytime you go for a walk or you go to the gym, you begin to have all this classical wheezing, coughing, chest tightness, and feeling that you're drowning in your own air and blood. Now, for you to be diagnosed, you have to see a doctor. There are specific things we are looking out for. Some people can develop asthma from childhood. Some people, it might be adolescent. Some it might be later in the adulthood. But for any reason, you be careful. There are some disease conditions that can also present like asthma, like COPD, chronic obstructive pulmonary disease, pneumonia, bronchitis, anxiety, heart disease. They can all present as if you have asthma, but you might not have asthma. Now, how can we diagnose you? You go to the doctor. We ask you a lot of things about your symptoms, about your history. Then we do physical examination. Then we ask you about your habits. Then we ask you about the type of things, irritants, allergens in your workplace, the type of house you live, where you live, if you have a conditioner. We need to ask a lot of things so we can develop our theory. Sometimes we also need to go through what we call spirometry and do a couple of other advanced tests before we can categorically say, yes, this person has asthma. Thankfully, there are things we can do to treat asthma. Remember, it's a chronic disease. So this means you can only treat it, but you cannot cure it. My people, there's a difference between prevention, treatment, and cure. You can cure things like malaria because you know that when you treat the Plasmodium falciparum, you cure malaria. But you can treat and manage asthma. You can't cure it. It's important to understand this because so many people might be telling you a couple of things to confuse you, just to place you in a very good place, and you begin to have problems. Asthma is not something you joke with. Now, some people can manage their symptoms, and over time, they will rarely have attacks. So the key word is what? Management. Now, you need to take steps to control your attacks and prevent problem by working with your doctor or your nurse to set a personal asthma action plan. You take your medications, you stay away from your triggers, you take your flu shot. We discovered that when you're exposed to flu exposure can exacerbate your asthma, and your asthma can also exacerbate flu. Like in the era of COVID, people that have asthma have a little bit of risk factor of having bad effects of asthma. Now, for you to have a plan, you have to work with your doctor or your nurse to set the action plan. We discuss the type of medications you need. You discuss when you need to take them. We discuss how you need to monitor the asthma. Some people will be given some instrument to check if they are doing okay. And we also teach you on how to look out for triggers. Now, what are the common triggers? I've been mentioning triggers. So triggers are the things that will lead to the attack itself. Tobacco smoke, animal urine, saliva, dander, dead trees, dust mite, cockroach, air pollution, mold, pollen, perfume, cold air, wood smoke, anything whatsoever can trigger your asthma. Now, how can you prevent the attack? Like I said, you monitor the air quality, you monitor the pollen, you stay inside when the pollen level is high, you use air conditioner, you mind your household, you keep away from cockroach, you vacuum your environment, you make sure you have good air, you stay away from pets. If you have asthma and you know that your triggers are from pet, then you avoid pets. Very, very important. You don't smoke. You don't stay with people that smoke. You make sure when you're cooking, everything is well ventilated. You make sure when you're spraying your perfume, or if you can avoid perfume completely, you avoid them. Now, when you are having your period, change in your hormonal levels throughout your period can also make your asthma symptoms to be worse. So women that are bleeding might notice they might have severe form of asthma, or women that are ovulating will notice they have severe form of asthma. So your cycle can influence the severity of your asthma. If your asthma symptom is getting worse during a particular time in your cycle, please track it and discuss with your doctor. Very, very important. So when you see your doctor, you tell your doctor about the attacks, the period you notice it in your cycle. Then you tell your doctor if you're taking birth control. Then you tell your doctor if you're on any hormonal treatment whatsoever, because they can interact with each other. Now, some people we can prescribe over-the-counter medication, like common pain medication, like ibuprofen, like aspirin. Unfortunately, in some women, this can also trigger asthma. So you are careful with anything that enters your mouth. Now, how can asthma affect pregnancy? Unfortunately, it can. Many women who do not have asthma will not notice this. But when you are a known asthmatic, it's very important that your asthma is properly controlled before you become pregnant. Now, when you become pregnant, it's also important you maintain the drug we will give you. Thankfully, there are some drugs that are approved and recommended during pregnancy. So you need to be careful because asthma can cause problem for you. It can cause problem for your baby. It can affect the whole pregnancy. And women that have asthma are prone to having a couple of pregnancy complications like preeclampsia, gestational diabetes, placenta problem, having your baby early, having a low birth baby, and having a C-section. No, these are all the likely complications you might have when you are an asthmatic. So the problem is not that you won't become pregnant and have your baby. The problem is that when you become pregnant and have because of your pregnancy, you might likely have preeclampsia, gestational diabetes, placenta problem, having your baby before 37 weeks, low birth weight, and obviously going for CS. These are all in line with making sure you have good outcome. Like I mentioned, there are some drugs that are safe you can take during pregnancy. Your provider will tell you the ones you should take and the ones you should not take. Like I mentioned, there are some painkillers that will lead to the attacks. So don't be your own doctor. Make sure you run everything by your doctor and make sure you're very, very, very careful if you are an asthmatic. Very important. Okay? All right, thank you so much. That's my presentation this evening. So the clinic is going to open now. Feel free to ask your questions. In the next few minutes, I'll provide you feedback. Okay, the clinic is open. Thank you, my admin, for coming. And IV or SARS, please feel free to ask your questions. The clinic is open now. We can quickly run this clinic and end the clinic in the next 2 minutes. Round it up at 20 minutes. Yeah, thank you so much, Kenneth. Please feel free to ask your questions so I can provide you feedbacks. Remember to subscribe to our channel in YouTube. Remember to share all the important links. There are so many things you can benefit from our channel. Our channel is fully loaded. It's more like a health encyclopedia. There is no topic we have not covered in women's health, in fertility, and in general health. So make sure you go to our channel, watch our videos, subscribe, share with your community. Our aim is to help everybody to know their body better. What kind of doctor does one need to see for asthma? The type of doctor you need is a doctor we call pulmonologist. Pulmonology. So pulmonology is the special aspect of medicine that study everything about respiration, the lungs, and all that. Now, there are also some subspecialists in pulmonology. So some people can strictly be referred to allergy specialists, people that specialize simply in this form of medical problem. So you can go to a general practitioner. You can go to your family physician. They can manage the asthma. But when it begins to be difficult, when it's not really controlled, when you begin to have severe attacks, you have to be referred to who? A pulmonologist. Very important. How do you know that your child asthma is well controlled? So here's the deal. You notice all those symptoms I mentioned, right? Wheezing, breathlessness, shortness of breath, chest tightness, frequent infections. Unfortunately, when you don't get enough oxygen, when you have a buildup of fluid, when you have a lot of inflammation, you tend to develop infections. So kiddies that have this type of problem might develop infection. Some kiddies will need what we call nebulizer to open up their airways so they can breathe. So don't be surprised if you see some kids who put a lot of nebulizer and breathing treatment for them. It's to help them to breathe better. So if your kids over time, in course of treatment and management, they develop lesser wheezing, lesser shortness of breath, lesser infections, then you might be in line with right outcome. Thankfully, some kids can develop juvenile onset asthma, and over time, they can outgrow it. So especially Kids that are born early, before 37 weeks, they can come into this world because they don't have enough surfactants. So surfactants are the stuff that will help a newborn baby for the lungs to expand so that air can come in. Now, if your baby was born before 34 weeks, the possibility that the lungs did not mature properly is high. So there are some babies that will have problems with breathing, and over time they might develop some symptoms as if they have asthma, but over time they can outgrow it. But if you develop asthma in your adolescent and as an adult, it's a disease condition you have to manage throughout your life. Yes, some kids can outgrow their asthma. Correct. Very, very good question, Kenneth. Are there tests that are done to monitor one's asthma? Correct. So there is this, instrument we'll give you. We call it peak flow meter. So you can use it to monitor the level of, your breathing and all that. Then we can also give you breathing exercise. So there are specific tests we can also use. There are a couple of things we can do, and there are also a couple of examinations and a couple of lab tests we can use to monitor your progress. So the answer is yes. It's not something you can do by yourself. You definitely need a specialist that will take time, monitor, and make sure you have quality of life. The fact you have asthma doesn't mean you can't enjoy life. There are certain things you cannot do. You definitely don't have any business smoking. You definitely should be mindful the, temperature of the water you drink. Make sure you don't drink excessively chilled water, and make sure you don't stay in stuffy room. So there are a couple of lifestyle modifications you should be mindful of, that you can have pretty much good quality of life. And remember, asthma can kill if it's not properly controlled. We've had so many people that died from asthma because they were looking for their inhaler and all that. Okay, please keep asking me questions. Ask your questions, please. Feel free to ask your questions. Exercise can make one pant. Should one exercise if you have asthma? Yes, but moderate exercise with good ventilation. You see, exercise has some good component, because if you already have problems breathing and you go and exercise, you are already increasing a couple of things that will increase your metabolism, your endorphin is up. So you tend to actually increase blood supply and blood flow. So you tend to get better. But the level of exercise you will engage in, if you're an asthmatic, must be mild to moderate exercise. You don't have any business going overboard. When you go overboard, you can trigger your asthma. So the answer is yes. Okay. Beautiful questions from my amazing admin. So Ivy, do you have any questions? Ken, a great job for the questions. If we don't have any other question, we're gonna exit. Make sure you register for this month's masterclass in our group. We are gonna talk about long-term infertility. If you have been believing God for a baby for more than 2 years, you have long-term infertility. And we have decided to take the war to infertility. We don't want any member of our community not to have a baby by 2023. So please go and register for that event. Registration is currently ongoing. It's going to be on the 26th. Make sure you invite your partner, and make sure you learn something new. Make sure you're committed to becoming a mother. Take some bold steps. Can living in dusty place cause one to develop asthma? So here's the deal. If you have asthma already, that dusty place can be your allergen, can be your trigger. But the isolated dust itself, it's a risk factor. It's not a causative factor. So dusty place will not directly lead to asthma. But if you have the probability, if you have the risk factor of developing asthma and you expose yourself to that particular allergen or trigger, definitely you're going to develop it. But on its own in isolation will not cause asthma. Okay? Beautiful question, Ken. I love that. So the key word is to know where to classify all those stuff. They are mainly classified as allergens. Now you need to be careful. Some people have hyperreactive airways. Some people are allergic. Some people, sneeze a lot just by default. Like I know I have allergies, so I take my antihistamines. So when you have allergies, antihistamine is going to help you. But here's the deal. When you're taking any antihistamines, there are some antihistamines that are drowsy. Like if you're taking Benadryl and all that, it can be drowsy. So you don't want to be driving or, handling some very sharp equipment when you take them. You take them towards your bedtime so that when you feel drowsy, you go to bed. You had your mens. I want to believe you meant menses 2 weeks ago. You were surprised to see it again yesterday. You cannot have another normal bleeding within 2 weeks. That's not possible. If you have a short cycle, you can bleed at the beginning of the month, then you can bleed towards the end of the month, but you cannot bleed within an interval of 2 weeks. It's called dysfunctional uterine bleeding. So you need to go to your gynecologist. We need to know what's going on. Okay? So I wouldn't know. It can be anything. It can be body weight. It can be fibroid. It can be polyps. It can be anything. It can be infection. It can be inflammation. But I can't just tell you because I don't have your history and I don't have my basis to kind of narrow down my diagnosis. So you need to see your gynecologist. Okay? All right. Can poorly controlled asthma turn into worse lung disease? 100%. If you have poorly controlled, undiagnosed asthma and it's not controlled, it can spiral down. You can develop pneumonia, you can develop COPD, you can develop those forms of respiratory diseases that can actually warrant you to be on oxygen. So anytime you see anybody on oxygen, that means the person can no longer breathe by themselves. We need to help the person to breathe. So the answer is yes. And if you are not careful, the moment we are not controlling it, it's damaging other organs in the body. Because remember, when you have asthma, you're not getting enough oxygen. And if you're deprived of oxygen, the cells that need oxygen will not function. So your organs might likely be packing up and you wouldn't even know. So you might likely be having organ failure because you're not getting enough oxygen. So if you don't have enough oxygen in the brain, you can have stroke. If you don't have enough oxygen in your heart, you can have heart attack. If it's in your kidney or your liver, they can pack up. So over time, when you lack oxygen, which is the basis for everything we do in life, then you can begin to develop complications, including death. So the answer is yes. Okay? Now, I'm not surprised with the numbers. The numbers are tanking. But guess what? Every topic in our community is important. I know it's not your bread and butter, fertility, multiple pregnancy. Don't select topics. All topics are very important. Someone would have known better about asthma by just attending this clinic, and you know better. Okay? But thank you for coming. I have about 3 more minutes. I actually wanted to end around 20, but it's 27 now. So if you still have questions, feel free. I'll provide you feedbacks and we can go. Okay? All right. If we don't have any other question, admin, you can give me a signal so I can exit and go get some rest. Thank you for coming. I appreciate you. Okay, it looks like we don't have any other questions. So thank you for coming. The next clinic will be on Saturday. Okay, can I thank you? Next clinic will be on Saturday. Remember that our Saturday clinic comes a little bit early. 12 p.m. Eastern Time, 5 p.m. Nigerian. Our Tuesday's clinic is now 6:30, not 6. Okay? Thank you for coming. I appreciate you, and I will see you next on Saturday. Until I see you, God bless you and bye-bye.